Hi, everyone. Thanks for joining this really exciting webinar presented by PracticeWeb on the 12 reasons you want to upgrade from Data Team to PracticeWeb. And we have a great webinar planned out for you, going through all the ways that you can really help your practice thrive and boost your productivity and revenue in the office by simply switching from Data Team to PracticeWeb. So your presenters today are myself, Neil Kotari, the Chief Operating Officer of PracticeWeb, and Manny Torres. A lot of you may have spoken or worked with Manny before. He's our Data Team Specialist. He's also our Support Manager at PracticeWeb. So we have a great panel here to help you really understand and navigate the reasons why you should upgrade as soon as possible from Data Team to PracticeWeb. I want to start with this thought, which is very, very insightful from Bill Gates. So he says that by helping us to become more productive, technology lets us to spend less time on survival and more on solving other challenges. So this is really our goal at PracticeWeb for you and your team. We want to help you become as productive and as efficient as possible when it comes to your dental practice management software, and really help you figure out ways to save hours of time and boost your revenue so that then you can focus on providing great patient care and really improving the patient experience. So you can really focus on those aspects of your practice as opposed to the main mundane tasks where we can really make you productive and effective. So why PracticeWeb? It's a great question, something that we're going to really talk to you about today and demo for you. But the first reason that comes to mind, or first area, is to improve clinical charting and case acceptance. So these are two areas that are really core to everything that you do in the dental office, and we want to help you get better at charting, be a lot more precise and accurate, and also improve how well your patients accept your cases and kind of take on what you are presenting to them. Another area is we want to help you with PracticeWeb increase billing revenue and get paid faster. So we're going to show you some great techniques that are in PracticeWeb to get you better results and make sure that all that time and energy and effort you're expending on the treatment side is rewarded with the optimal amount of reimbursement. Next, we're going to look at how we can streamline your scheduling and boost your appointments. Get more people in your operatories, in your chairs, and make that whole process very, very efficient. Another area where we can help at PracticeWeb is allow you to communicate and market better to your patients. Now, in this day and age, if you're not communicating well, you're not getting the word out about all the great things you're doing in your practice in a kind of modern approach, then you're really, really leaving a lot of opportunities on the table. So we want to help you get very, very good at communicating and marketing to your patients. Another great area is to go paperless. That can be with your patient forms, but a whole lot more than that. And we will talk about that today and show you different ways where we can help you go paperless. And last but not least, we want to help you customize your security and permissions regarding the software to your specific practice needs. And that's really, really important because you have all types of team members and different people doing different things. And so you want to be able to customize your security and permissions that matches what you're doing. Okay, so with that, I'm going to get right into showing you how PracticeWeb is better in these areas than Data Team. So the first reason why PracticeWeb is better than Data Team, why it's worth upgrading to PracticeWeb, is the excellent clinical charting options that we have for you. So we want to show you how the clinical charting can be improved, as well as how you can boost your case acceptance. But before we show you what can be done in PracticeWeb, let's take a reference point in Data Team. So in terms of Data Team, what type of charting options do we have? Manny, and what can we do in terms of charting in Data Team?
Well, in Data Team, or should I say the lack thereof, there's no real 3D chart to quickly view any patient's history. If you need to view any work done previously, it's a lot of scrolling. You pretty much have to scroll to the right year and hope you find the procedure that's listed. Everything's kind of centered around the ledger, whether it's notes, comments, charting, anything like that. It's all centric to this one ledger, no visual graphic for the patient or the doctor or hygienist to view at a glance at that point.
Okay, so yeah, I mean, it's kind of a little bit bare bones, and there's not too much when it comes to graphical tooth charting or doing a lot of different procedure statuses, et cetera. So let's look at some of those great options in Practice Web. When we come to the charting module, the first thing you'll immediately notice is we have a really beautiful, nice graphical tooth chart here in the top left area. And this is really fantastic because it helps you see at a glance all of the work that has been done on this patient, anything that's planned to be done, and any restorations or existing work that was done outside of your office. You can do a lot more, which we're going to look at in a moment with this graphical tooth chart. But to get started, let's take a look at how we do charting. It's a 3-step process, very, very simple. As an example, let's do a posterior composite on tooth number 32. So we'll select 32, select the entry status of completed, and then this is a really nice feature here. These are quick buttons, so you don't even have to type the surfaces. You can just select MOD for your posterior composite, and it will get you the right procedure code, and everything is done very, very easy on the back end for you, so you don't have to do anything except just to click the few buttons. So that's an example of how quick and effective our charting is. Now, when we look at this graphical tooth chart, at the top right area, you'll see a number of tabs which really take advantage of the graphical tooth chart. So if we start with missing teeth, you can select any tooth and mark it as missing if that's the case. If we go to the movements tab, we can even show something like if we go to occlusal and do some minus there, the minus button, you can show, click on the minus button on the occlusal, and then we'll show an impacted tooth here. You tip that on the mesial tip and add that, and you'll see here's an impacted tooth. So this is another great way that you can take advantage of this graphical tooth chart. Now, if we go to the primary tab, that's simply an area where you can mark teeth as primary, permanent, or even a mixed dentition for adolescents in your office. But if you're a pediatric practice or dealing with children, you can really use this to accurately reflect their condition in the tooth chart. And then finally, we have that draw tab near the end. And that is something where if you want to write something on the chart, point something out to one of your patients while you're doing some education, trying to get that case acceptance, you can really do that. And that's very, very effective, both from a record standpoint and a patient education standpoint. So now if we look at the progress notes section, so you'll see a section down there below those tabs where it says, right now it says treatment plan. That's your progress notes section. And you can have several different preset views that you design. And this is great because now you can really pinpoint, I'm looking at certain types of data that I need to look at. If I want to look at my procedures, or if I want to look at even specific work that was done on this tooth, I can do that and click the selected tooth option. So here we've set up, if we go there, you can see on the selected tooth option that this is what's been done on that tooth. So we've set up a couple of views here: treatment plan view, completed treatment, existing treatment, conditions, treatment, doctor's view as well. Also, you could have even a front office view where they just see the appointments and communications. So the progress notes section is really comprehensive. It's showing everything from not only the procedures to your lab cases, which is a great feature we'll talk about, prescriptions, emails, communications, forms that were filled out, everything that's related to the clinical side. So that progress notes section is very, very useful. Now, as I just mentioned, we have lab cases that are not available in Data Team. So you can create a lab case for a patient. So if you need to send something out to get done at the lab. You would set up your laboratories and who you are regularly dealing with, and you would set up their turnaround times, their expected turnaround times. So that will automatically then calculate the date for you of when that case should be received by your office based on the type of work that they're doing. So that you can see was selected there. And then we have an instructions section at the bottom. And that instructions section is where you can type in all your notes for the lab. Yeah, so Manny, if you want to write there in the instruction section, we're going to do a crown on tooth number 3. That's just a quick example of the type of instructions. And then if you click on new slip, that will actually bring up the lab slip that is going to be sent out, and you can sign that and send it out however you want. You can print it or email it, create a PDF, etc. So a lot of great options here to send out that slip to the lab. So now, if we go back to this screen here, you can see that it's created at the top. There's a tracking area. You can then also mark when it was sent out, ultimately when it was received back, quality checked, etc. So all of this information and this lab case will show up in your progress notes. So if we click OK and go to the progress notes section, right there is your lab case. Another great thing that we won't demo at the moment, but just as information, you can attach lab cases to appointments where you're going to actually deliver that case. And if that lab case has not been received by the day of the appointment, you'll get a red alert that's very visible, hopefully giving you enough time to reschedule that appointment if you haven't received that case in the office. So great feature there with lab cases. I do want to take one step back to where we were before. Let's go to the Enter Treatment tab. And I do want to spend a little bit more time on this procedure button section. So let's go to that general category just to see all the other options. So you can set up any categories you'd like, but I do want to point out and emphasize that you can really have all of your most commonly used procedures set up here. So it really becomes like clockwork when you're charting procedures. So I want to put a little bit of an underline on that and emphasize how great that feature is. Now, another thing is Perio charting. So, and in Perio chart, one thing I want to point out is we have a great charting module for this, but also we have this voice Perio feature, which is great because now you can use any microphone that works with your computer to speak out a number of commands, all your measurements, and any other types of observations you want to record, like plaque or calculus and bleeding. All of that can be done using voice Perio. So now you don't have to use an assistant, have them occupied helping you out, or making, or even if you don't have an assistant, making your Perio charting a little bit kind of broken up and disrupted by you recording measurements. This is a great feature called voice Perio, along with the excellent Perio charting module that you see here. Now, last thing I'll point out before we leave the charting module is going to be the prescription section. So you can create prescriptions. We also have e-prescribing. So in a lot of your states around the country, either now or in the near future, it's legally required to use e-prescribing for certain types of medications, whether they're controlled substances or even in some states, non-controlled substances. So this is going to be a really important service, and you don't want to use a standalone service because that's just really going to waste a lot of your time and not be a streamlined approach. So an integrated service like we have will really help you because all of the prescribing you're doing will be recorded in this Practice Web chart. And when you're getting into the prescribing service itself, it will pick up the patient you're working on, the provider information, and all your saved favorites and everything, and you can really quickly prescribe medication electronically. So another great aspect of charting. Now let's go into the next reason why Practice Web is going to be a better option for your office than Data Team. And so this reason number 2 is on the accounting side. And Practice Web really is great when it comes to accounting. It's a very effective module, and it has its own dedicated accounting module. So before we get into that, we will take a look at what we have in Data Team, but kind of club this to join this together a little bit with reason number 3 the reason number 3 why PracticeWeb is a great choice is eClaims and pre-authorization. Even eClaims and pre-authorizations are much easier in PracticeWeb than Data Team. So to look at reasons number 2 and 3, let's first take a look at what we have in Data Team. So Manny, when it comes to Data Team, how is the accounting module? Is it pretty easy to use? Are there some things left to be desired there?
Yes, there's a lot left to be desired. Again, both the charting, accounting, anything like that is all combined within the ledger of a patient. You don't know the status or where we're exactly at with a claim. You're either outstanding or unsubmitted. You can't visually see any claims that are sent out without running, a separate report. Um, the ability to upload claims is, pretty lengthy. You have to create a batch and then upload that batch outside of Data Team through, a dental exchange portal. Hope everything settles, and then, make sure you don't have duplicate claims within your Data Team program.
Yeah, so it seems quite difficult to be effective when it comes to accounting and Data Team. So with PracticeWeb, I'm just going to highlight a few of the great things there, but there's so many to speak of. But just a few I'd point out. Just first starting with the account module itself, everything is very well organized in this dedicated account module. You can see everything that's happening, whether it's payments, adjustments, claims, procedures, everything that you need to look at it at a glance, really. And also along with that, you can see that the insurance information is very clear at the top and the side to see what the benefits look like. Also the balance and aging, also the communications that you've been having with the patient are clear at the very bottom of this section. Also, if you want to set up any payment plans, if you do that, it'll clearly appear at the top. So everything is very, very easy and quick to see and understand here in the accounting module. So along with this really well organized accounting module, I want to show you some next level strategies and options that you have in PracticeWeb. So if we jump over to the payment screen, then we'll see that in the top right area of the screen, we have a couple of excellent merchant card processing options. So one service that we recommend is called Pay Connect through Dental Exchange. And now you can use that service to directly swipe cards, credit cards for payment. You can also, take the card and type in the details, but all the credit card processing can be done through Pay Connect, whether it's authorizing a charge, submitting an actual charge, doing a void payment, a refund. All of those things can be done right from within this payment screen. And that will all automatically get processed without having to go to a separate portal. And it will also show up in the account module as a credit card payment or a credit card transaction. So merchant card processing, frequently requested, that's a great feature. Another one I'll point out is called Pay by Text. So that is, if we go back to the payment screen, we can see just where that button is. And so here you see a Pay by Text. It's grayed out right now because it's not activated, but Pay by Text is a great feature because that will allow you to really do a contactless payment option and speed up your cash flow in the office. So as soon as you press that button, it will send out a request for payment to your patient via text message, and it will show them what the charge is for, the amount, and then the patient will be able to enter their credit card details from their phone, and they're not required to set up any service or account with ProPay, which is the service, but merely just type in the credit card details and submit that. And once that's submitted, it will deposit the funds into your bank account and then also show that payment in your account module in PracticeWeb. So a really great feature called Pay by Text. So along with those great payment options like Pay by Text and merchant card processing, we have a really, really great eClaims functionality in PracticeWeb. So when we click on New Claim in PracticeWeb, it will bring up your claim screen. And unlike Data Team, you don't have to create a batch and then separately upload that to the Dental Exchange portal. You can do everything right from here. And even along with Dental Exchange, you can use other clearinghouses if you so wish to do so. So from this claim screen, you would set up the claim, make sure everything is accurate, including attachments. So you can even do integrated attachments from this claim screen. So if you need to include any images, radiographs, documentation, narratives, to make sure that you get reimbursed, you can do all of that from right in this screen. And that's amazing because if you have to do that traditionally, you generally have to go to a separate service, a different portal, and create an attachment, get the ID number, and then put it into your claim. And it's very, very tedious and cumbersome. So integrated attachments and all the eClaims are submitted right from within PracticeWeb. Really, really great option. So you send that out, and then you can effectively track it as well on the back end when you get the reimbursement. So that's the eClaims, and now the same thing goes for pre-authorizations. So if you need to do a pre-authorization, you would jump to the treatment plan module, and you can go to that pre-authorization button in the top left after you select the procedure from your treatment plan, and you select the insurance plan where you're going to submit this. It will generate a claim similar to the eClaim for reimbursement. You would create this claim for pre-authorization, make sure you include your attachments if you need to right here, and then you would simply click send, and you're done. But we'll click OK for now, just to show how that would appear in waiting status if you're not yet ready to send it out. So that's a great way to do pre-authorizations, very, very efficient. So reasons number 4 and 5 for why you would want to upgrade from Data Team to PracticeWeb have to do with appointment scheduling. So we have a very powerful appointment scheduling module in PracticeWeb. But before I get into some of those key components, let's look at Data Team. So Manny, how does scheduling look in Data Team?
Scheduling is pretty, I want to say, depleted or basic, anything like that. You don't really have much control over your scheduler. You can create some dentist times, anything like that, but there's no real setting blockout types, anything like that, or no separate views for different parts of your staff, anything like that. You're kind of limited to what you get here on the screen at that point.
Yeah, so it seems like there are some serious limitations, and you can get your scheduling done, but there's not a lot that the software is doing to really help improve that workflow, and it's not really partnering up with your team to boost appointments and just make your day a lot more organized. So that's where we shine in PracticeWeb. So if we jump over to PracticeWeb, one of the things I'll point out is blockouts. So you don't have blockouts in Data Team. You do have that ability in PracticeWeb. Blockouts are great because any consultant that you talk to, any practice consultants that are effective and useful, they're going to talk about why it's important to use different types of blockouts or block scheduling to get a nice mix of appointments in the office and make sure you're meeting your production goals. So with PracticeWeb, we really partner up with you and help you do that. As you can see here, we've created a couple of sample blockouts, like a new patient appointment blockout. So you want to schedule just new patients for certain times and certain operatories, you can do that. You can have major procedures blocked out for the afternoon. You can have, what is that pink area there, Manny?
This is hygiene.
Hygiene, yeah. So you can have hygiene blocked out and make sure that you get your recalls in. And then along with that, if you want to make sure that your lunches are blocked out, you can do that. And you can see right there, you can even have a blockout that prevents you from scheduling on top of it. So make sure that you respect that blockout. So that is one really nice feature when it comes to appointment scheduling. Another one is the appointment views. So if we look at the view drop down on the right side, we have some setup here to show you. We have a front desk view, operatory 1 and 2 view, HIPAA view. So for example, in the HIPAA view, if you don't want to show certain patient information, you can set that up and customize that. And you can have a hygiene view as well. So let's take a quick look at how easy it is to customize these views and create them. So we jump over to that setup screen, and that's the appointment view screen. And over here, you can see the ones that we've created. If we double click on any of them, it will show all the options you can customize. So you can customize operatories that are appearing in that view, provider bars for the different provider schedules. You can show within the appointment block what pieces of information are relevant. So, for example, if you want to show if a recall is past due, if you want to show their work phone number, different contact information, if you want to show their birth date, if they're on a discount plan in your office, if they have a medical urgent note that you want to point out and make sure everyone sees. All of this is done through this appointment view section. And if we click OK and exit that, then we'll see, that this is a very, very versatile feature in appointment scheduling. So with that, let's talk about some other great reasons why you want to upgrade from Data Team to Practice Web. And reason number 6 is really patient communication. And along with that, we have these really powerful appointment lists that we'll highlight for you. So Manny, before we look at that in Practice Web, what are the options to communicate with patients in Data Team?
You'll have the traditional ways. Mail is the or the main option you'll have in Data Team. You can create certain letters or postcards within Data Team and have that mailed out by the office. Going
Yeah,
from
or you
that,
can just simply pick up the phone. Kind of these,
and pick up the phone and call. Yeah, just
like
that.
1990 methods of communicating with patients. So
Yeah.
we want to bring you guys up to, the year 2020, the year 2021, and can really help you take advantage of the actually effective ways to communicate with your patients. So let's jump over to Practice Web. And one thing with Practice Web is you can do a lot of emailing. So obviously emailing is a great way to reach out because it's going to obviously be better than sending postcards, letters, and snail mail. They call it snail mail for a reason. It's very slow and ineffective. So emailing is really a great option in Practice Web. You can send one-off emails. You can even do emails that are like mass marketing. If you want to send out a mass email to all your patients about a dental special you're running, you can do that through Practice Web. Along with emailing, we have texting. So texting is by far the most effective way to communicate, since everyone has their smartphones and mobile devices on hand in their pockets. You can quickly reach them. So if you want to send one-off text messages, you can do that. But also, there is so much that texting can do for your appointment scheduling. So starting with automated texting. So with automated texting, you can send out automated text messages to confirm your appointments, to remind patients about their appointments, and even do recall reminders. So when a recall is coming due, you can make sure that they're aware that they need to get that scheduled, and then they can text back, and you'll see that in Practice Web. So there's a lot of automated features that are very, very productive, and we've seen it work wonders for our clients. So also from this PW Connect module, you can even do marketing to all your patients. So if we go to that second tab on the left, which has like a loud phone there, megaphone, you can see here that there's a marketing campaigns feature where you can text everyone something that, so let's select a text message there to show them an example. Just check all and then go to the second drop down, select that default message, and then click on search patients. Yeah, so you'll see here that if I wanted to send any sort of marketing message, you can customize this to your liking from the text templates section, but you can send a mass marketing campaign via text, and it's very, very effective and can bring in a lot more people and fill your chairs. So along with that, we have appointment lists. So let's jump to our appointment lists in Practice Web. Now, these lists are very useful, even if you're not using texting, because it's a great way to really fill your chairs from multiple angles. So whether it's getting patients in because they're due for recall, making sure people are showing up for their appointments with the confirmations list, making sure that patients who have treatment that's been planned for them but not scheduled yet, making sure they get scheduled. So that's the plan tracker list. And then anyone who was unable to come in for an appointment, you want to put them on the unscheduled list and basically get them rescheduled at a later time. So no one is slipping through the cracks. And then finally, we have an ASAP list where if you have a gap in your schedule, you can quickly jump to that list and try to get that filled by a patient who wanted to come in sooner for their treatment. So those are the 5 kind of appointment lists where it really helps you fill your schedule. And the last 2 are related to insurance verification and radiology. So now if we look at some of these lists, let's jump over to the recall list. So along with that automated recall reminder that I mentioned earlier via text, you can create any sort of list here based on recalls due in the last number of months and figure out who those patients are. And then you have options to obviously call them if you'd like to, send them postcards, you can do that too, or you can email all of them or even text message them. So let's look at the texting option. If you click on text, you'll see that it has selected everyone who had a valid phone number, and it's showing the message that's going to go out. And you can customize this message like any other and create your own templates there. And that will be a great way to reach out to them for recalls. And you can do this sort of thing with all of the appointment lists that I mentioned. So even if we go to plan tracker list, you'll be able to do the same thing and contact everyone who hasn't scheduled their planned treatment yet. So, this is something that is going to transform your patient communication in the office, and we do it at a very, very low cost for your practice. So that is really reason number 6 with patient communication and the appointment list. So now let's go to reason number 7 to switch from Data Team to Practice Web, and that is to help you go paperless and even contactless, especially when we have all the health and safety concerns that we have right now. This is a great, great aspect of Practice Web. So let's focus in on patient forms on that aspect of going paperless, because that's really where you create a lot of paperwork and paper in your office. So when we look at Data Team, can you do any sort of patient forms in Data Team, Manny?
No, not outside of, just creating a letter and sending that, anything like that, but nothing within Data Team as far as, screening forms or financial agreement forms, extraction forms, anything like that. No.
Okay, so and I think the blank screen sort of speaks for itself there.
Yeah.
So yeah, not much of anything you can do with patient forms and Data Team. Now, if we switch back to Practice Web, you really have a lot of options. So included in the core package that you would be getting with Practice Web, you have online forms and mobile forms. So before we jump to that topic, however, let me just show you here. This is an example where you have a medical history form assigned to this patient, Ken Spock. And so if you double click on that, you'll be able to see that form. And you can customize these forms. It's really easy to do that, or we can help you customize the forms. So whatever you'd like to accomplish with your forms, we can get you there. But once you have set up your forms, you can either use a traditional method of printing that out or even emailing it to the patient, or you can use our next level sort of feature of online forms, which is again included in what you're getting with Practice Web. So if we jump over to web forms, we can see, I mean, this is where you would retrieve the forms, but if you wanted to set up the forms, you would go here and kind of create any number of kind of packages of forms. Even you could create a form that has or a package that has multiple forms, or you can even do something like this, which is like a COVID-19 form. And this is mobile friendly. So when you're filling this out on the phone, it really is designed to make it very quick and easy for them to complete their forms. And once they're done, they would click submit. They can even sign this at the bottom. And after they do that, they would click submit. And then you would be able to retrieve that within Practice Web. So if we click submit here, and we can actually require certain fields to make sure that they complete it the way you'd like to have them complete it. And along with the birth date, it's going to require you to fill out these checkboxes. So we have to make sure the form is requiring them to answer these questions to make sure you get complete data, especially for something like a COVID-19 screening form, like what we've set up here. So we've clicked all these things. We're very healthy, ready to come in. And you click submit, everything is submitted. Now we would jump back to Practice Web, and we can retrieve that form that was filled out online. And you see here is the patient. So now this patient may have done something that's not a perfect match for an existing record. So this is a great feature because it's going to prevent unnecessary duplication of patient charts and records. Instead, it's letting you choose the right patient and then assign it to them. So now you've retrieved that form and it's already automatically attached to that patient's record. You can pull it up anytime you go to the chart. So if we go back to Practice Web, you'll see that. So you jump to, we have that patient selected already, and we just simply, you could do it from the chart or really any module, and click on that Forms button at the top, and you'll see it there too in the progress notes. So over here, you'll see the answers and the signature, and then actually, if you want to see the signature, you can click on Create PDF, and that'll show the signature for this form. And anytime you want to print that out, or even if you want to email it to the patient, you can do so. And you can even have a staff member sign that as having been reviewed for COVID-19 screening. So this works the same whether it's patient registration, medical history update forms, financial agreements, HIPAA forms, privacy forms, consents for different types of treatment. All of this can be done using online and mobile forms. So that is an excellent feature. And then we also have a lot of other options. You can even use an iPad app that we offer if you want your patients to fill out their forms on an iPad. But when it comes to the online forms and mobile forms we were talking about, you can put that on your website to have them go there to your website and fill it out, or you can text it to them if you're using our texting service. You can email it to them. So there's multiple ways to get that to the patient, even while they're in the operatory, in the chair, where you would say, oh, you would think, let me just go and print that out. You can actually even quicker, you can just text it to them and they can fill out their form while they're in the chair to give that, let's say, a treatment consent. And that's all done efficiently, where you don't have to create more paperwork and everything is now in the system automatically. And it's contactless, so you're not exchanging paper, exchanging pens, and having to sanitize things for health and safety. So it's a great thing with patient forms. Now, the 8th reason why you should upgrade from Data Team to Practice Web is on the insurance side. So really, that is a large time sink in any dental practice, is checking insurance eligibility and benefits and making sure it's done properly, it's done accurately. So before we look at what can be done in Practice Web, what can be done when it comes to eligibility check and in benefits check in Data Team?
Yeah, well, okay, so in Data Team, there's not much of that. You still have to get the correct information and call the insurance company. That's pretty much it. You can only you can call the insurance company and find out, benefit information, if they're current, what's their, limit annually right now, anything like that. You still have to actually, pick up the phone and call.
Got it. So really, long story short, there is no option for real-time insurance eligibility and benefits check. So let's jump over to Practice Web and show you one way you can do this in practice. So if you jump to the family section and into the insurance plan, then we'll see that there's a button there under request electronic benefits. There's a request button. If you have that service set up through Dental Exchange, you would simply click on that button and then it would submit a request instantaneously to the insurance company, and you would instantly get a response showing all the benefits information for this patient based on, of course, the insurance carrier and the group name, the group number, the subscriber ID, all of that information. So as long as that's accurate, you're going to get accurate benefits information. And this works with 99% of insurance plans and companies out there. So it's really effective. And then you would simply import that with a single click, and you have that benefit information right in the insurance plan. So just imagine that you took a sometimes 30-minute process and turned it into a 1-minute process, or even a 30-second process. And so multiply that times the number of patients you have in any given day, and you'll just quickly realize how much time you're going to be saving. Not only that, it's going to be much more accurate than calling the insurance company and making sure you asked all the right questions and got the information you needed. So that is an excellent feature to verify insurance eligibility and benefits. And this is certainly not something that's available in Data Team. So with reason number 9, we want to talk about reporting. So reason number 9 to switch from Data Team to Practice Web is that you have much more informative and customizable reports. And those reports are exportable, and you can manipulate them however you like, to really slice and dice the data to understand how your practice is doing at any given time. So with Data Team, what kind of options do we have with reporting, just to give a reference point on that?
You're limited to your reporting. Again, you have a few financial reports as far as your day sheets. You do have a few as far as your day sheet, procedure tracking. They're very limited as far as what you can bring out, into the report, anything like that. Even manipulating it at all, there's no ability to do that. So still limited in Data Team as far as your reporting goes.
Okay, so let's look at Practice Web and how it's really a breath of fresh air when it comes to reporting. So in Practice Web, you have several standard reports, and I think it numbers somewhere north of 60 reports. So we're every upgrade, we're adding new ones that are either requested or we think are going to be very useful for your practice. So whether it's production income or looking at your daily procedures and payments and adjustments, or on a monthly basis or a weekly basis, looking at your insurance claims and your aging and accounting, everything is really accessible from this reporting module. So as an example, let's pull up the production income report, and let's look at just the more options there, because that's a customizable version of it. So here you can see you can run it as a daily production income, monthly, annual, or by provider. You can select which providers are appearing on that report. If you are using our multiple clinics feature in Practice Hub, you can even select by clinic and then select any date range you'd like, even to the point of how should your insurance write-offs show up. Do you want them to show up on the insurance payment date, the procedure date, or the claim date? So fully customizable production income report. And if we run that one, we'll see, just to get a taste of what it looks like. This is the annual report. So annually, you can see the production, the adjustments that hit that production, the write-offs, and then your total production, which is kind of an accurate number there. And then on the right side, you're looking at all the income line items. So patient income, insurance income, and total income. So very nice production income report. Another thing is, if we go back to the reporting section, we'll see that there's a monthly production goal report. So one thing in Practice Web is in the appointment schedule, if you look a little bit to the right side, you don't have to exit, but yeah, you can look right there in the right side. There's a daily production and daily goal field. And so you can set up your goals based on an hourly goal for each of your providers and based on the schedule that they have for that day. And it'll show you what your goal is for that day, and then also what your daily production is. So are you on track to that goal or not? Now, if you go back to the reporting module, there's reports. There is a report which will show you more data about that and see if you're hitting your monthly production goals or not. So that's another great tool on the reporting side. Yeah, so just looking here at your production goal, what was scheduled, adjustments, write-offs, and your total production. So again, making sure that you're on track to meet that goal. Now, another area of reporting I'll point out is with the insurance claims. And so if you're dealing with a lot of insurance, you know how difficult it is to manage that process. So whether it is outstanding insurance claims, like these listed here, you can see everything in one place and kind of select any criteria you'd like, any date range you'd like. And then as you're following up with each insurance company, you'll quickly see their carrier and plan info and patient and subscriber info at the bottom of the screen. And you can double click on any of these line items and jump to that claim. So if you need to correct something or resubmit something, it's very easy for you here. So that is a great report on the insurance side. We have other reports when it comes to claims that haven't been sent out yet, or even procedures that should be billed to insurance but have not been attached to a claim. So you can even make sure to capture all of that and nothing falls through the cracks. So that's the procedures not billed to insurance report here. Now, that is reason number 9. So reason number 10 is, why should you switch from Data Team to Practice Web? Well, you have, as we mentioned at the beginning of this webinar, a lot of different team members in the office doing different things, and you want to make sure that what they are able to do and access and accomplish in Practice Web is tied to their responsibilities and not more or less than that. So that's really where the customized security options and permissions options in Practice Web is very, very useful. So Manny, if you can jump to that user permission screen, we can take a look at what that looks like. So are the security settings, and if we jump to the user groups, which is where you really set up the permissions, you can create as many user groups as you'd like. You can even create it for a single person or a few people in your office. And then in that middle section of the screen, you'll see all of the different permissions. So almost to the atomic level, to the molecular level, you can see what can be accessible or not for any given person. So very, very customizable security permissions. And they have a high level of security when they're logging in. Every user is logging in with their own password. You can make sure they have very strong passwords, and there's an auto log off feature. So if you want them, if they're not working at their computer for more than a number of minutes, you can make sure that it automatically logs them off so no one else is going in there and doing any funny business. So really, really great security. Now, reason number 11 to upgrade from Data Team to Practice Web is, again, on the insurance side. So this is dealing with multiple insurances. A lot of Data Team clients have asked us if they can be able to add more than 2 insurances to a patient's record. Manny, I think in Data Team there's that limitation, correct?
Correct. Yes, you can only add 2 insurances to patients.
Yeah, primary and
That's your limit.
secondary.
Primary and
Can you,
secondary is
can
all.
you do medical insurance and medical insurance billing there?
Not in Data Team, no.
Okay, so let's go look back at Practice Web. And we'll see in Practice Web, if we pull up a patient that has multiple insurances, then we'll see what that consists of. So here you can see that we've set up not only primary and secondary, but other insurance as a tertiary, and then a medical insurance plan as well. So depending on every patient situation, just be assured that you can put in as many insurance plans as you'd like for a patient, and even do medical insurance billing if you're doing any sort of oral surgery procedures or any procedures that can be billed under medical insurance. So that is reason number 11. And then to round everything off, reason number 12 to upgrade from Data Team to Practice Web is billing statements. So billing statements are obviously very, very important. We just talked about insurance, and the other side of the coin is making sure patients are paying their share for treatment. So with Data Team, I think there's some clients, correct me if I'm wrong, Manny, but some clients like to, or they have been printing billing statements on very special paper. Is that right?
Correct. Yes, we do have a lot of Data Team clients that monthly, every month they're ordering billing statements that, run anywhere $100, $200 per order, anything like that. It is a specific statement paper made for Data Team clients at that point. It's really your only option you have outside of, just getting a third-party company to extract your data. You have to upload it to them, anything like that. So.
Yeah, so the statements are not fun. I mean, you don't want to be having to put it on expensive paper. So Practice Web can print billing statements on any paper, which is going to save you money right there. And not only that, it's fully customizable. So you can really customize what your billing statements look like, make sure it has the information on there that you want to see. And so it's really, really a great billing approach. The other thing when it comes to billing is, if you want to send electronic billing statements, you can do that as well. So there's a dental exchange service that allows you to send out statements where the patients can actually pay online. So they simply click on the payment options that you're providing them, and they can make payment online, and you take care of all of the remaining share that way. And that's going to be a much quicker billing cycle for you than otherwise. Also, you can email your statements out. So Manny, if we go to that billing list. If we generate a billing list, we can take a quick look at that. So there's going to be multiple options. So you can print out your statements, you can email them, or you can, just do that electronic method I talked about. So here, these are all set for mail, but you also have the option, if you double click on one of those statements, right there, there's an email option. So if you do that, you will be able to email it out as well. And you can even put it in their patient portal and have them look at it there. So billing is really, really effective and efficient in PracticeWeb. So with that, let us turn to some other important topics in terms of how can we get you onto PracticeWeb if you're interested. And we've gone over some really great reasons, those 12 reasons. So Manny, let's take a look at some of those other aspects of making this transition. So we do have this fantastic year-end special offer that expires at the end of this month. And this is just an incredible opportunity to make this switch to upgrade from Data Team to PracticeWeb. So the first thing that we're offering for free is the software, the installation, and the training. Now, normally we would charge around $700 for all of this, but for all the Data Team clients, we're doing this for absolutely free. The next thing is a free data conversion, a huge benefit to your practice to help you make the switch. Normally we charge around $1,300 for this. We're going to do that for free for Data Team clients only. And as experts in both Data Team and PracticeWeb, we'll make sure your data transfers very smoothly. And we'll talk a little bit more about that in a moment. The third great free aspect here are all of the other tools that come with the software. So you have your dentist and patient portals where the dentists and the patients can access their information through online portals from wherever they are, from whatever device they want to access it from. We also have the mobile and online patient forms that we talked about, and a graphical practice analyzer, which is just a even better reporting tool where you can see everything graphically of how your practice is doing. So a great value there, regularly $1,175 a year. That is a total savings of $3,169 that we're offering in this special deal for end of the year. Now, all you do is pay $99 a month for 24 months. And along with everything I just mentioned, you get unlimited help from PracticeWeb pros like Manny. You get training, you get software upgrades, which every few months we will come out with new features and just better ways of doing things to help you stay on top of the best approaches that are out there, and a whole lot more. The great thing about this offer is that you lock in this low rate. So this rate is very, very low. We normally charge $169 a month to get started with PracticeWeb. So you're getting a really great savings of around $840 and you're per year, and you're locking in that rate for 24 months. So even if we raise prices further, you won't see an increase. So really, it comes down to the fact that price is a no-brainer. $99 a month is almost what you're paying right now for Data Team, but you're really upgrading from a proverbial Honda to a Ferrari. So really turbocharging your practice with this switch. Now, I'm going to turn it over to Manny here because we want to talk a little bit about how we do a lot of hand-holding to make sure that you have the best experience possible switching over to PracticeWeb.
Yes, and again, there are many offices that have converted already, and we don't just send you some forms to fill out and then leave you on your own. I will be with you for the whole time during the transition, even more like a concierge between Data Team and PracticeWeb throughout the process, the converting, the setup, installation. I'll be your contact person throughout the entire time. There's no you won't be left in the dark during any of the conversion process at that point.
Yeah, and a great thing about that is you get a risk-free test conversion, so you really get to see how your data will transfer to PracticeWeb before you commit to paying anything. So there's really, like I said, it's a no-brainer to do at least do a test conversion and see how everything's going to look.
Yes.
And then lastly, I'll just speak on behalf of our training team. We have trained several Data Team clients onto PracticeWeb. So we really know where you are now, like all the 12 things we looked at on this webinar, and where you can be with Practice Web, how much you can improve. So we'll be able to refer back again and again to Data Team, how you used to do things in Data Team, and now how you can do those same things in Practice Web, but so much better. So
Yeah.
that makes the training really, really effective as well. So now the question, with all this excitement on 12 reasons and the great offer, you must be thinking, how do I sign up? So the way to sign up is to contact our friendly sales team at 800-845-9379 and option 1 for sales, or you can email us at sales@practice-web.com. And that will be the best way to get set up with this. If you have any questions, if you're still unsure, if you want to get an individualized demo of Practice Web, then we can do all of that for you. So there's really nothing that you have to worry about in making this switch. So with that, we'd like to thank you very much for joining us on this important webinar.
Thank you, everyone.
Helping your practice thrive and getting into 2021, really helping you hit the ground running and just transform your practice for the better. And Manny, any final words for all of our Data Team clients?
No, just keep plugging away. New year, new feel. Let's get some new software to go with your practice.
Perfect. Yeah, I think it's a great opportunity, golden opportunity to make this change, and especially before you're going to pay for your annual fees with Data Team next year. And that's another note, is that if you do end up paying some fees and you've decided in a month or two you want to do this, hopefully we still have this deal running at that point. We're not sure, but if we do, if you want to make that switch, then we will prorate any fees that you've paid already towards that. So there's really not any financial risk for you, whether you switch now or later. But this is a really great end of the year offer, so you want to jump on that right now. So we thank you again for spending your valuable time with us, and we look forward to working with each and every one of you in this important transformation that you're going to go through. Thank you very much. Thank you, Manny.
Thank you. Thank you all.
Thank you.
Bye.
Goodbye.